I'd like to talk to you about what I consider a silent epidemic in the world that has been going on who knows how long, since the beginning of time perhaps. And that is trauma, or rather I should say unresolved, untreated trauma that builds up and causes problems. And we might know this sometimes as PTSD when it's extreme, but even at low levels, it has effects on the body, mind, and spirit. My name is John Moore, and I am a teacher of shamanism and a shamanic practitioner. I work with people, in healing situation and coaching and mentoring situation as well. And when I started my practice, I actually started to work on unresolved childhood trauma that I had that was causing me significant issues physically, mentally, and spiritually. I had experienced severe depression, anxiety. I lost something like 60 pounds. My doctor was like, do not lose any more weight. And I couldn't eat. I couldn't sleep. Big issues. And I was worried about being a good dad, being a good friend, being a good person when I couldn't manage, I couldn't manage work. I couldn't manage my own life basically. And so I came into shamanism to heal myself because I got a very clear message from spirit, but also because shamanism has been known for many, many thousands of years as having tools for treating trauma. And why is because they had to, because there weren't doctors, psychiatrists, psychologists, therapists, up until very recent in human history. So we had to, as a people, go to some, tribal person who understood psychosocial, spiritual aspects of the human being. So I want to talk about trauma, what trauma is. I'm going to talk about both the kind of the psychological model of trauma or a psychological model of trauma. There are many. And I'm going to talk about a shamanic model of trauma. There are probably many. I'll talk about the one I'm most familiar with. And I'll talk about how they overlap a little bit. And also talk about what some symptoms of trauma are that you might want to address. That being said, this is in no way medical or therapeutic or any kind of professional advice. You don't take professional advice from YouTube. I'm not a medical practitioner. If something I say resonates with you and say, oh, that might be a problem for me, by all means, seek out the help of a therapist or talk to your doctor or talk to a medical professional. You can also go to a shamanic practitioner for healing as well. Personally, I like to recommend that clients do everything they possibly can in treating whatever it is they're coming to me with, meaning they can come to me and I will work with them on the spiritual aspects of trauma, but they should probably also be in talk therapy at least, and they can decide with their doctor or psychiatrist if they need any sort of medical intervention. I cannot weigh in on that, nor should anybody else who is not a professional who has seen you and diagnosed you and whatever. Everybody's an individual. But trauma does show up in some sort of patterns in people and what can happen with them. And so I'll talk about some of the theories of trauma as well. But I really want to get to the shamanic model of trauma because I think there's really some overlap with modern psychological models. And there's a lot that can be gleaned from our ancestors, and from indigenous cultures that still exist, that still practice this stuff today, and from shamanic practitioners like myself who kind of live in both worlds at the same time. Trauma is anything that causes a shock to your systems, like extreme fear or fear for your life, or even witnessing something terrible happening to another human being. So it could be you can get trauma from a natural disaster or war or violence, abuse, all kinds of things. There's also this developmental trauma that happens with children. And unfortunately, the powers that be that create things that you can actually diagnose people with do not draw a distinction between PTSD that somebody gets from wartime or some other thing as an adult and developmental trauma, which happens over a long can happen over a long period of time during formative years and cause, brain changes and all kinds of things that do actually have some different manifestations. Yes, it's trauma. Yes, there are some symptoms that overlap with PTSD, but I really wish that the psychiatric community or the psychological community or whoever writes the DSM would include developmental trauma disorder or something along those lines, or CPTSD. Also, people call it complex PTSD, because they do need to be recognized and treated differently. And if you get children with trauma and you treat them improperly, for example, there's lots of misdiagnosis and improper use of different types of medication because the people don't know how to diagnose these kids, you can cause damage, and that's problematic. Neither here nor there, I guess. The trauma, so it's this shock to the system or abuse or whatever, it's more likely to cause a problem if the situation is A, not under your control, and B, caused by another human being. So the less control you have over the situation, the more likely you are to develop PTSD. So being in war, for example, very chaotic, you have no control over the situation. Being a child and being abused, you don't have control over the situation. Your parents are larger than you. You rely on them for all of your needs. And so it's really, really impactful. And then the other thing is that apparently trauma that's caused by another human being to us or to somebody else that we witness is also more impactful. For some reason, we are hardwired for this social aspect that gets triggered when the trauma is caused by another person. So somebody attacking me in some way might be more impactful than me falling down and getting hurt, for example. There's still trauma there. It can still affect you. I'm just saying it's more likely to have lasting PTSD-like symptoms if it's caused by another person. At least it seems that way in the current research. Some of the symptoms, there are lots of symptoms of trauma, PTSD, unresolved trauma, complex PTSD. The number one thing that I see with clients who come to me with trauma is dissociation. And I think that it makes a whole lot of sense when we look at trauma as kind of either a fractioning of the soul from a spiritual perspective, or we look at it as a fracturing of the psyche or fracturing of the self or fracturing of the identity from a psychological model perspective, right? What happens from a shamanic perspective is something occurs to me that is a threat, whether it's existential or not, whether it threatens my life or not. My body doesn't know a whole lot of difference. There's all kinds of research going on with how the body reacts to trauma. The vagus nerve that goes from it's a cranial nerve that, goes throughout your body and winds up in a lot of systems. It affects your heart. It affects your inner ear. It affects your muscle tone. It affects your release of cortisol and all kinds of stuff. So when this trauma happens to us from a shamanic perspective, part of our soul, which can split apart and do all kinds of stuff. It's very flexible, and our soul is very affected by our life experiences. It carries our life experiences. What can happen is a part of us jumps away to be safe. It says, I'm I'm going to protect this part of myself. Maybe it's a younger part of myself, or, I'm just going to completely split. And sometimes that part gets lost or stuck in time. And this is where more modern psychiatric or psychoanalytic treatments like parts therapy, internal family systems come in really handy, because there are saying there are different aspects of the self. And we see this, like you can see this. You think of, we think of ourselves as kind of a single person, but we change roles all the time, right? Like when my children were babies or toddlers, I definitely interacted with them in a different way than I interact with them now that they're teenagers, right? Or I don't talk to a lover the same way I talk to a bank teller when I walk into the bank. They would, at the very least, give me funny looks and maybe have me escorted out of the building. So we have all these different roles that we kind of slip into easily, these different personalities, these different personas. And yes, there's a continuation of consciousness that we identify as us, but parts of us can get split away. And those parts, some shamanic practitioners like myself we call soul essences. They're parts of ourselves that bring certain abilities, certain understandings, certain power, for lack of a better term. So, for example, if all of a sudden I lost my ability to slip into the role that I could communicate with a lover with, my girlfriend, or, and I couldn't communicate with that person anymore at that level because that part had split away and I was unable to, it didn't come back, or I was unable to bring it back, that might cause some problems for me. And it might create a sense of dissociation where I feel kind of pulled outside of my body. Now, there's two things that sort of qualify as dissociation. And I have had clients, and dissociation is kind of a technical term, and I dissociated for decades and didn't know what it was until somebody said, it's this or this. I said, oh yeah, I do both of those things all the time. Dissociation comes in two flavors. One is depersonalization, meaning I don't feel like I'm in my body all the time. I feel floaty. I feel detached from my body. Sometimes I can view things like I'm looking from outside of my body. That's dissociation. And, and the depersonalization part of dissociation. And shamans do this on purpose, which is why in some shamanic cultures, you have to have gone through trauma to become a shaman, because it's necessary to have the ability to dissociate at will. However, shamans are able to reassociate at will as well, where with trauma, and I can speak to this from experience, you can know you're dissociating and still not be able to like snap out of it or bring it back without significant effort. We'll put it that way. And if you don't know how, it can be impossible. So the other type of dissociation is called disreality. And disreality means that you feel like the world around you isn't real. It's almost like you're moving through a dream. And I can recall experiencing bouts of disreality as a child, from a very young age, up and through adulthood. I remember times where, snapping into a state where all of a sudden the entire world, almost like being underwater, and things were kind of blurry and felt like they were moving in slow motion. I don't know how better to describe it than that. It feels very dreamlike. It feels like you've lost touch. You're a little bit numb. Your skin goes numb. For me, my tongue would actually start to tingle, and that would be in my face, and that would be part of what would happen when I was depersonalizing as well, is that my face would start to go numb, and then I would almost feel like I was being pushed back behind my head. It's if you've never experienced it, this probably sounds really strange. If you have experienced it, you'll be like, oh yeah, that's what happens. So dissociation, in my experience, is the number one, meaning the most common, and kind of, in my experience, always happens in some form, minor or major, with unresolved trauma, PTSD like symptom. There are lots of others. To get a diagnosis of PTSD, for example, you have to hit a bunch of criteria, things like having flashbacks, things, which definitely is a symptom of trauma, things like, extreme anxiety around situations that remind you of the trauma, unable to go places where the trauma happened. There's all kinds of things like that. So in the shamanic model, and this is pretty cross-cultural, this soul part, this soul essence gets disconnected, gets lost. We do call that soul loss. And the treatment for that is a ceremony called soul retrieval. Soul retrieval is life-changing. It has been for me. It is not instantaneously miraculous healing frequently. Sometimes it is. Sometimes people feel better right away, but that's not to be expected, because normally, imagine if you lost a child who was 6 years old, and then you recovered them when they were 20. And they were lost for that whole time. It would take time for you to make that child feel welcome and to reintegrate with the family. And that's what happens with the soul parts. You have to bring them back, kind of unfreeze them from time, and work to integrate those parts back in. But once you do, there's significant amount of psycho, spiritual, and physical change that can happen. And I can tell you that I have been living mostly, I say mostly because there's times where I feel a little bit of anxiety, or something makes me, something reminds me of a situation, but I'm aware of it and I have more control over it. But I've been living primarily symptom-free. I would say like 98% symptom-free for many years. And, I did a combination of things. I took care of myself physically. I did talk therapy for years. But shamanism is really where it was at for me. And there were a lot of practices in shamanism that helped me out. And soul retrieval was a big one. So soul retrieval is the way that ceremony that shamans do to treat soul loss, which happens from trauma. Now, there's other ways soul loss can happen, that aren't just trauma-based. So you can have a long-term illness that can cause soul loss over time. So there's sort of this leakage that can happen where parts of you sort of drift away and get lost. You can also live in an environment that is unhealthy. So you can live in an environment where there is not physical abuse, but where there's lots of mental abuse. And that can cause, especially over time, that can cause soul loss. You just feel like your soul is being drained away. You can work in a job for many, many years that people call it, like life draining or soul draining. Like we have ways of describing these things, these experiences, these relationships that just suck the life out of you, or a job that just sucks the life out of you. And that's what it is. We're literally describing these relationships and jobs. So when I say that trauma is an epidemic, it's a silent epidemic that is global. I could probably, of everybody I know in the world, I can only think of a very, very low number of people who do not have some impact from trauma in their life. Do all of those people qualify for a diagnosis of PTSD? No, they don't. But that doesn't mean they're unaffected. Okay, you can be affected, you can have some of the symptoms, but not all of the symptoms. You can, you can have one symptom, in an extreme way and not show any of the other symptoms. And to get a diagnosis, I think it's 5 out of 7 or something like that. You have to You know, they have to check the boxes, and it has to go on for a certain period of time, and all of this stuff needs to happen. Another, in case you couldn't tell from me, from the way that I talk and do these, another symptom of trauma, particularly childhood trauma, is it affects your attention. And so I think a lot of adults who have what we might consider attention deficit problems, I don't know about disorder, maybe that's something different. And again, I'm not a doctor, but attention deficit problems, I think, stem from childhood trauma in a lot of cases. And I see this over and over again with people I know and clients that I work with and myself and members of my family. So it's definitely something because it impacts the part of the brain. And soul retrieval can help bring that focus back. You can imagine having like all of these parts of you scattered to the winds and trying to focus on a single thing. It's very difficult, very challenging. And so again, that's a way that I might still be affected, but I can tell you that it's much better than it used to be as far as being scattered and all over the place. I'm much more focused than I used to be. But I probably have a natural predilection to looking at shiny objects and being easily distracted. So anyway, I just wanted to talk a little bit about trauma, the shamanic model of trauma, the shamanic treatment for trauma. If any of this resonates with you and you are not, I would suggest seeking some sort of counseling to begin with. Again, if you want to look for shamanic healing for trauma, do that, but do that in conjunction with the other things that you're doing. Shamanism addresses the spiritual aspects of healing, and we want to address everything, the body, mind, and spirit. With that, I thank you. I hope that you will subscribe to my channel. I have got lots and lots of great videos coming on the way, and I will talk to you real soon.